Picture this. You're home alone, maybe enjoying your morning coffee or watching your favorite show, when suddenly something doesn't feel right. Your chest feels tight, or maybe one side of your face starts to feel numb. For those of us over 60, this scenario isn't just scary, it's a real possibility that we need to be prepared for. But here's what most people don't realize. There are specific actions you can take right now, even when you're completely alone, that could save your life. I'm going to share with you 5 critical strategies that every senior should know about surviving a stroke or heart attack when help seems far away. These aren't complicated medical procedures, they're simple, practical steps that anyone can remember and use. Stay with me, because what you learn in the next few minutes could literally be the difference between life and death, and I promise these techniques are much easier to master than you might think. First, let's talk about recognizing what's happening and responding without delay. The biggest mistake people make during a medical emergency is waiting to see if things get better. I remember reading about Margaret, a 69-year-old woman who felt sudden weakness in her left arm while gardening alone. Instead of thinking it would pass, she immediately stopped what she was doing and called for help. That decision saved her from permanent disability. Your body sends clear signals when something serious is happening. With a stroke, you might notice sudden confusion, trouble finding words, or weakness on one side of your body. A heart attack often starts with chest pressure, like someone sitting on your chest, along with sweating, nausea, or pain that spreads to your shoulders or jaw. The tricky part is that these symptoms can be mild at first, especially in seniors. Many of us have lived through aches and pains for years, so we're used to toughing things out. But this is different. When these specific symptoms appear, your brain or heart is in immediate danger. Every minute you wait, more damage occurs. Margaret understood this instinctively. She didn't worry about bothering anyone or feeling embarrassed. She trusted her body's warning and acted fast. The psychological part of this is huge. Fear makes us want to deny what's happening. We tell ourselves it's just indigestion or we pulled something. But that denial can cost us everything. Training yourself to recognize these moments and respond immediately is like having a superpower. Keep your phone charged and nearby always. If you can, wear one of those medical alert buttons. Most importantly, give yourself permission to call for help the moment something feels seriously wrong. Now, let's discuss what you can do for yourself while waiting for help to arrive. When you're alone during a heart attack, there's a technique that many people have never heard of but could keep you alive. It's called cough CPR, and it works by forcing your heart to keep pumping blood when it wants to stop. I heard about Frank, a 74-year-old retired mechanic who was fixing something in his garage when chest pain hit him hard. He remembered learning about forceful coughing from a health class and started coughing hard every few seconds while he called 911. That rhythmic coughing kept him conscious until the ambulance arrived. The paramedics told him later that his quick thinking probably saved his life. Here's how it works. When you cough forcefully, you're essentially squeezing your heart and pushing blood through your body. It's not a cure, but it buys you precious time. Cough hard and deep, like you're trying to clear something stuck in your throat about every 2 seconds. Keep doing this while you're calling for help or until help arrives. For strokes, the focus is different but equally important. You want to stay calm, sit down if you can, and focus on slow, steady breathing. Don't lie flat because that can make things worse. If you feel dizzy, sitting with your head between your knees can help. The key is staying conscious and keeping oxygen flowing to your brain. Practicing these techniques when you're healthy makes them automatic when you need them. Frank practiced cough CPR after learning about it, so when his emergency happened, his body knew what to do, even though his mind was scared. This isn't about becoming a doctor, it's about being prepared to help yourself when seconds count. Understanding what your body is telling you goes beyond just knowing the symptoms. It's about really listening to what feels different or wrong. Take Dorothy, a 71-year-old grandmother who noticed that her morning routine felt harder than usual. She felt unusually tired, had mild chest discomfort, and felt slightly sick to her stomach. These weren't dramatic symptoms, but they were different for her. Dorothy had learned to pay attention to changes in how she felt, not just dramatic symptoms. She called her doctor, who told her to call 911 immediately. At the hospital, they discovered she was having a heart attack. Because she caught it early, the damage was minimal, and she recovered completely. This is so important for seniors because our symptoms can be subtle. A heart attack might feel like bad indigestion. A stroke might just make you feel confused or dizzy. But when you know you're normal and something changes, that's your cue to take action. Keep a simple journal of how you feel each day. Note your energy levels, any discomfort, changes in your thinking or coordination. The other crucial part is trusting yourself. Dorothy could have easily talked herself out of calling for help. The symptoms weren't that bad. She didn't want to bother anyone. Maybe it was just something she ate. But she had trained herself to take changes seriously, especially combinations of symptoms that were new for her. Don't wait for symptoms to get worse. If you notice several warning signs at once, even if they're mild, that's the time to act. Call 911 and let the professionals decide if it's serious. Dorothy's story shows us that early action, even when you're not completely sure, can make all the difference between full recovery and permanent damage. Your position and breathing can actually help save your life during an emergency. When Eleanor, a 76-year-old retired nurse, felt the warning signs of a stroke while alone in her kitchen, she immediately sat down and positioned herself to breathe as easily as possible. She leaned slightly forward, resting her arms on the kitchen table, and focused on taking slow, deep breaths. This wasn't just to stay calm, though that's important too. The way you position your body affects how well your heart and lungs can work during an emergency. If you're having heart problems, sitting upright or leaning slightly forward takes pressure off your heart and makes it easier to breathe. Lying flat can actually make chest pain and breathing problems worse. For breathing, think slow and steady. When we're scared, we tend to take quick, shallow breaths, which doesn't help our bodies get the oxygen they need. Eleanor focused on breathing in slowly through her nose, holding it for just a moment, then breathing out slowly through slightly pursed lips, like she was blowing out a candle gently. This technique helps calm your nervous system and ensures you're getting good oxygen to your brain and heart. The mental benefits are just as important as the physical ones. When you're controlling your breathing and positioning, you're taking action instead of just being scared. Eleanor later said that focusing on her breathing helped her stay calm enough to call 911 and clearly explain what was happening. That clear communication helped the dispatcher send the right kind of help quickly. Practice these positions and breathing techniques when you're feeling fine. Sit in a chair and lean forward slightly. Rest your arms comfortably and practice the slow breathing method. Make it feel natural so that if you ever need it, your body will remember what to do even when your mind is stressed. Keep your phone where you can reach it easily from this position. Eleanor had her phone on the kitchen counter within arm's reach so she could call for help while staying in the position that helped her breathe. Simple preparation like this can make a huge difference when every moment counts. The final and perhaps most critical point is understanding that speed saves lives. When Thomas, a 68-year-old widower, woke up with chest discomfort and shortness of breath, he didn't waste time wondering if it was serious. He had learned that with heart attacks and strokes, the treatments that work best have to be given quickly, often within hours of the first symptoms. Thomas called 911 within minutes of noticing his symptoms. At the hospital, doctors were able to give him medication that dissolved the clot in his heart artery. Because he acted so fast, his heart muscle was saved from permanent damage. The doctor told him that if he had waited even an hour longer, the outcome could have been very different. This is why every minute matters. There are amazing treatments available now for both strokes and heart attacks, but they have to be started quickly. Clot-busting drugs for strokes work best within the first few hours. Heart attack treatments are most effective the sooner they're given. The difference between getting help in the first hour versus waiting several hours can be the difference between full recovery and lifelong disability. For seniors living alone, having a plan makes all the difference. Keep emergency numbers programmed in your phone and maybe written down where you can see them easily. Practice describing symptoms clearly and calmly. Know your address and how to give directions to your home. These simple preparations help emergency responders get to you faster. Don't let embarrassment or worry about bothering people stop you from calling for help. Thomas said later that he briefly worried about calling an ambulance if it turned out to be nothing serious. But he realized that being wrong about an emergency is much better than being wrong about ignoring one. Emergency responders would much rather come out for a false alarm than arrive too late to help. The most important thing to remember is that you have more power than you think in these situations. Thomas's quick action, combined with staying as calm as possible and following the positioning and breathing techniques, gave him the best possible chance for a good outcome. He took control of the situation instead of just hoping things would get better. As we wrap up, I want you to think about how this information can change your life. These 5 strategies, recognizing symptoms immediately, using self-help techniques like cough CPR, trusting early warning signs, proper positioning and breathing, and acting fast without hesitation, these aren't just tips you might use someday. They're tools that can save your life. Maybe you're thinking this won't happen to you, or that you have family nearby so you don't need to worry. But life has a way of surprising us, and emergencies don't always happen when it's convenient. Being prepared isn't about being pessimistic, it's about being smart and taking control of your health and safety. I'd love to hear from you in the comments below. Which of these strategies surprised you the most? Have you or someone you know ever faced an emergency alone? Share your thoughts and experiences because your story might help someone else feel more prepared and confident. If this information was helpful, please hit that like button and subscribe to our channel so you don't miss future videos that could help keep you healthy and safe. Share this with your friends and family members because everyone deserves to know how to protect themselves in an emergency. Remember, knowledge is power, and now you have the power to take action if you ever face one of these scary situations alone. Stay safe, stay prepared, and I'll see you in the next video where we'll continue talking about ways to stay healthy and independent as we age.